Hi everyone, Dr. Aziz speaking. It's been so long. I miss you all. I just wanted to let you know that we did start seeing patients this week. We're seeing patients only appointment by appointment, patient by patient. When you come next time, you're going to notice some changes in the office. First thing that you're going to notice, Sue is going to ask you some questions over the phone. Make sure that you don't have any high fever, cough, or runny nose. And then when you come in, you please do not come in right away. So use this doorbell here, and then either Lisa or Sue is going to come out, and they're going to take your temperature, make sure that it's not over 100.5, and then we will ask you to fill out the form. And then we have these shoe covers too. So these are the clean ones that that you can use, and then once you leave the office, you can take them out and put in this box here. It is not a requirement. It is not a requirement, but you know, we are trying to do everything that we can. So come in. And then we want you to wear your mask. Make sure that you have your mask. But if you don't, it's okay. Don't worry, we'll give you one. And then when you come in, when you check in, make sure that you stand behind this plexiglass here. And Sue's gonna be here, of course. You can use the hand sanitizer. And then you notice that the coffee machine is no longer here. I'm sorry. And then magazines, newspapers, they're gone too. I'm sorry about that also. You can have a seat in the waiting room area until my hygienist or assistant brings you in. If there is another person in the waiting room area, which we really do not think that there is going to be, and plus luckily our waiting room is really big, so if there is, make sure that you don't stay too close. Make sure that you stay like 6 feet from each other or to keep the social distance. And then my hygienist or assistant, we're gonna bring you in. Now there are changes here too. So the one thing that we did change is actually our central air system. We did put new HEPA filters, and then we installed 2 UV light. So the UV light is supposed to kill the bacteria, the viruses that comes in, and then that leaves the office also. So we have 2 of those. And then, in addition to that, we have like an air purifier in each room. So this provides 3 stages of filtration. So there is like a fine preliminary filtration. There is also like a true HEPA filter in it, and there is also a carbon filter in it. And it is supposed to collect like 99.97% of the particles that may carry the bacteria, the virus. So it's going to help too, of course. And then we are going to ask you to rinse your mouth with hydrogen peroxide. So we're gonna mix this with 50% water, and then we're gonna ask you to rinse your mouth like 60 seconds before the procedure. And then if I do certain procedures, let's say like crown preps or root canals or maybe fillings, we're gonna use dry shield. So this is what dry shield looks like. So it goes in the patient's mouth, and you can rest your jaw on that rubber piece there, and it actually covers the tongue and actually pulls the cheek. So it protects the tongue, protects the cheek, and it has a high-speed suction built in. So it takes care of all the aerosols in your mouth. And the other thing that you're gonna notice, the additional PPEs that we're gonna be wearing. So one of them is going to be this hair cover, and then we're gonna have our N95 masks, and then we're gonna have our level 3 surgical mask that we're gonna put on, and then we're gonna have our face shield. Well, we're gonna have, of course, our lab coats too, like the long sleeve lab coats. Depending on the procedure, we might actually wanna use a gown also. So this is how we're gonna look like, basically. The thing is, why are we doing all this, of course? Well, our top priority is your health and your safety. So I'll see you soon.